And our online audience to the Friday seminar. Today, our speaker is Dr. Sean Tucker. Dr. Tucker is an associate professor in the Faculty of Business Administration at the University of Regina. His occupational health and safety research focuses on the influence of executive leadership on employee physical and psychological health, young workers and safety, migrant worker health and safety, and provincial work-related fatality rates. Dr. Tucker provides injury prevention consulting and research support to the Saskatchewan and Manitoba Workers' Compensation Boards. He also engages in safety-related consulting projects with public and private sector organizations. So please help me welcome Dr. Tucker.
Good afternoon, and thank you, Anit. And I want to begin by thanking Chris McLeod for hosting me during my sabbatical at the School of Population and Public Health. It's great to be here. It's a great group and lots of great work going on. I also want to acknowledge funding for the research that I'm going to present today was provided by the Saskatchewan Workers' Compensation Board, and I want to acknowledge the efforts of several individuals for their support in carrying out the research that I'm going to speak about. It's very much been a collective effort, and I especially want to highlight my efforts of my co-authors, Tunde Ogunforo at the University of Calgary and Dale Eyre at the University of Regina. So the guiding research question for this research is if and how CEOs influence employee and psychological well-being. There's almost no systematic research on this question. And to get us thinking about how organizational leaders influence safety, I'd like to start by considering a few perspectives on the topic. Since 2009, the U.S. National Safety Council has celebrated on an annual basis CEOs who get it. It's an award that goes to U.S.-based CEOs that are noted for their contributions and commitments to employee safety and building a strong safety culture in the organization. When the National Safety Council announced the 2017 winners, they stated that a culture of safety and well-being is one that takes time, dedication, a thoughtful approach, and a CEO who, quote, gets it. The 2017 CEOs who get it are leaders who not only understand how to run a great business, but also know deep down that safety is paramount for their employees, their clients, and their families. Closer to home in BC, we have the BC Safety Charter for CEOs. This is a growing group of CEOs in the province from industry that have made a public pledge to commit to safety in their organizations. The charter program notes that the charter represents the commitment from industry and organizational leaders to create a workplace culture based on the principle that the effective management of health and safety is essential to the long-term profitability, sustainability of organizations. The perspective of organized labor, of unions, is also relevant to CEO influence on employee health. So some of you may have heard of the United Steelworkers campaign to have an amendment to the Canadian Criminal Code enforced so that the directors, organizational leaders are held accountable for significant incidents in the workplace. And so the USW campaign notes that more than 1,000 workers each year are killed at work. Police and prosecutors are not utilizing the Westray amendments to hold corporations, their directors, and executives criminally accountable for the health and safety of workers. Of course, the reference to Westray, the reference to a coal mine that had a explosion in the early 90s that killed 26 workers. It was an entirely preventable incident, but the managers of the mine put production ahead of the well-being of their workers. So we have legislation in Canada on the books, but it's rarely used. It's rarely used in the U.S. as well. It's actually exceedingly rare. There's been legal prosecutions of organizational leaders. However, this case from 2016, involving Donald Blankenship. He's a former CEO of Massey Energy Company, which was a West Virginia coal mining company, the 8th largest in the US. He was sentenced to 1 year in prison for his role in a 2010 mining explosion that killed 29 miners. The facts of this case are strikingly similar to the Westray explosion. They failed to have proper ventilation, failed to keep down coal dust. There was a source of ignition and the whole mine went up. At sentencing, the judge, and you see the quote on the slide here, noted that you should be someone that we are able to tout as a West Virginia success story. Instead of being able to tout you as one of West Virginia's success stories, however, we are here as a result of your part in a dangerous conspiracy. So taken together, these perspectives would suggest that CEOs have influence on safety in organizations. But again, the research hasn't been done yet to look at their role. Now let's consider the views of a CEO, and this is a CEO that I think everybody in the room would know, but I'm going to conceal their identity. This CEO was giving a talk at Stanford in 2009 about how their career developed and their leadership style. The CEO reflected on safety at the start of the talk. They said, remain connected, you stay down to earth. I've had a number of experiences that really brought that home to me. The one that was probably the most profound was in Venezuela in the mid-1990s. I was a relatively young manager running the company's operations in Venezuela, and a young man was killed in the course of conducting one of our operations. And I went to the funeral, and at the end of the funeral, his mother came up to me and beat on my chest and said, why did you let it happen to him? Why did you let it happen? And that was a real wake-up call for me, that if you lead an organization, you have a duty to care for everyone in it. It's a fact. And the bigger the organization, the more people you're taking care of. And it's influenced enormously my view about safety in our operations. So on the face of it, this public statement would suggest the CEO is serious about safety. A public commitment in front of an audience. I said you all know about this person. His name is Tony Hayward. 11 months later, after he made that public statement, the Deepwater Horizon rig exploded, and it resulted in the deaths of 11 workers and the largest environmental disaster in U.S. history. Hayward was replaced a few months after the explosion. I could say more about Hayward, and maybe in the discussion we can return to his role, complicated role. There's evidence that in the lead up to the explosion a few years before that he was trying to reverse BP's culture of cost cutting, and that he was putting more attention on safety, but perhaps it was too little too late, or perhaps in a large multinational organization with multiple divisions, a CEO's influence is perhaps very little. So I want to now turn to research on employee safety as a way to segue into research, our research that we've done on CEO influence. And I've really simplified sort of grouped the research that's been done by level of analysis. There's lots of research out there on employee safety behaviors and employee injuries, what the factors are that lead to behavior, positive safety behavior and injuries. So at a macro level outside of organizations, a regulatory enforcement regime does influence injuries at the organizational level. There's provincial, jurisdictional differences in culture. In my province, in Saskatchewan, we have a culture where you jump in and get it done, and people work long hours during harvest time, and sometimes safety takes a back seat, and as a result we have a relatively high injury rate and the highest work-related fatality rate in Canada. At the organizational level, a common variable to study would be organizational climate, and I'll speak to that in a minute, and employee supervisor leadership behavior and how that influences employee safety behaviors. And research has also looked at individual differences in employees and how that contributes to safety behavior and injuries, personality, age, and other factors. So I want to focus on the safety climate, and we'll turn to that next. So safety climate is a concept that was first proposed by Dov Zohar in 1980 in a seminal piece. What is safety climate? It's the extent to which employees perceive that safety is genuinely valued in an organization, it's rewarded. It's a real priority in an organization. It's also a leading indicator of safety performance. And by that I mean of injury prevalence and of safety behavior generally. Key attributes of safety climate is one, as I mentioned, safety is a high priority. Two, there's a close alignment between words and actions. It's very action orientated. It's not about espousals about how important safety is. It's the actions back up the words. And third, Zohar notes that consistency of action spanning the organizational hierarchy. So from the top right on down through VPs, if we're talking a large organization, managers, supervisors, and frontline employees, that there's an alignment there. Some example to make this a little more real, some example measure of items in a measure that we'd use for safety climate. And again, you can see, having a look at these items, that they're very much focused on actions, real actions, and not just saying things about safety. This particular measure is one we actually use in the research. It's 10 of 16 items represented here. I would note at the top that the referent here is top management. So we'd use this in survey-based research and ask supervisors or frontline employees the degree to which top management in their organization enacts these behaviors using a response scale of strongly agree to strongly disagree, and aggregate scores across employees to come up with an organizational-wide score. The referent can be changed in research, and in our study, we'll get to in a minute, we do change this. So the referent can be the CEO in this organization, the supervisor, top management. So you can change the referent for the measure. In terms of a general model of employee injury, so if we're looking at the organizational level of analysis, this would be it here, and I want to stress that it's simplified. That the closest variable associated with injuries would be employee safety behaviors. So how compliant employees are with existing policies and practices, how motivated they are to enact safety behaviors, how proactive they are. Do they go take initiative and put in extra effort into safety? Group or supervisor safety climate. It's plenty of research to show that it drives employee safety behaviors. And then to the question, what drives the supervisor safety climate? That would be the wider organizational climate around safety. And this is again a sort of hybrid simplified model based on Christensen's all data meta-analysis in 2009 and Zohar's work as well. So to the central question, CEOs and safety, and in particular organizational safety climate. What we have to date has been mostly case studies or anecdotal evidence. There's very few studies that examine the impact of CEOs on safety, and part of the reason for that is access to senior management teams to study the behaviors of CEOs and just getting access to organizations. To date, there's been no research linking CEO behavior to organizational safety climate, a widely studied variable in the organizational literature on occupational safety. So I've already mentioned the challenges here, and there certainly are are many, and I guess to start with getting access to organizations. Employees, it's been my experience, generally don't like to fill out surveys. And when you get up to the level of senior managers and CEOs, the dislike of surveys is even higher. So that's certainly a challenge. And if you're doing organizational level research, you want to have access to dozens of organizations. So that does present a real challenge, is access and then engaging the senior management in the study. They want to know what's in it for them, what's how their organization is going to benefit from participating in research. So one of the related challenges, if one does get access, to keep surveys short, so you don't have participant fatigue issues. So it involves in some ways a bet of, you don't get to ask extra measures. You sort of bet on a short survey, and hopefully you've got the right variables that you're measuring and modeling. Opportunities for studying safety. I mentioned the BC Safety Charter, and those programs where a CEO makes a public pledge to safety, they exist across Canada. So Newfoundland has a program, Nova Scotia, Ontario, Saskatchewan, of course BC. And so Saskatchewan does have a program. It began in 2010. It was designed as sort of one lever to bring about cultural change in the province. We have the third highest lost time injury rate in Canada and the highest work-related fatality rate by far, actually. And so it's a public commitment. It's a document that CEOs sign, or equivalents, could be owner of an organization, or in the public sector, an executive director of a not-for-profit. So it's a diverse group. And they have an annual signing event and smaller regional events where they really are focused on organizational leaders to try to educate them on safety and how to lead around safety and develop a strong culture of safety in their organization. So as of last spring, there were 600 members in the charter group. I do note here that the charter firms have a higher injury rate than non-charter firms in the province. So this sample is very much reflective of the province of Saskatchewan. You've got some really organizations with really strong safety records and some with extraordinarily weak records. Just a quick word on my role as a researcher. So I work closely with the Gord Moker, who leads the charter program, and with the Saskatchewan Workers' Compensation Board on injury prevention activities. I have done both. There's a research side to this and a consulting side to this work. So I have done paid consulting work for Safe Saskatchewan, which runs the program, and I have done a little bit of evaluative work on the charter, but that's not going to be the focus of the presentation going forward here. So an overview on data collection. Sorry for the small font size here. So they have this annual signing event, and we go there and have a booth set up, and there's an announcement made that we're doing this survey, and we want to hear from CEOs, senior managers, and frontline workers. And in exchange for participation, we provide the organization with a benchmarking report. And we have organizations that have participated every year. We've offered this. So we're in our 6th year now of offering the survey. And they participate every year, and they can benchmark their own climate over time, but also against others in their sector. We do a lot of follow-up with organizations after the charter event to kind of coax them into the study and talk about benefits and that. And there's a lot of follow-up after they get the benchmarking report with how to use the report for goal setting and improving their safety climate. So surveys are completed by CEOs, senior management groups, managers, supervisors, and frontline employees, very short surveys. To date, we've had over 24,000 employees from 152 unique organizations participate, and these are private, public sector, resource extraction, healthcare, school divisions, manufacturing. It's a diverse group. And we've had, I think over the 5 years we've been conducting this, we've had something like 7 organizations do it each year. We've had 60 participate in 2 or more years. So back to the question of if and how CEOs influence employee safety, our first study in the project was an analysis of the 2012-13 cross-sectional data. So this is just data collected at one point in time. We had 54 single location organizations in the sample. I mentioned the benchmarking reports before. We do provide scores for individual locations. So if we have a school division participating in the study, it's not uncommon we'll report scores for 35 locations as well. So it's quite a bit of data effort to get that information, but it allows us to do more sophisticated analysis. There's the representation of sectors. You can see here public sector is the largest. That does include just a wide range: healthcare, school divisions, lots of different types of work environments represented there. Manufacturing is the next most represented. Average number of employees per organization was 376. We had 25% response rate to the survey among frontline employees in these organizations. So the participants in this analysis were 2,700 frontline employees, almost 1,400 supervisors, and over 200 members of top management teams. These are folks that report directly to the head of the organization: CEO, owner, executive director, what have you. Here's a table with the list of measures. So the physical safety climate measure that I showed you earlier, we used 10 items from that, and there's an example item there that only the top management team members would respond to. The head of the organization, the CEO or owner, insists on thorough and regular safety audits and inspections. We use the same measure, but all of the items in it, 16 of 16, to measure organizational safety climate. And this was completed by supervisors and managers in the organization only. Supervisor support for safety, just frontline employees completed this measure, and it was 10 items. We looked at physical injuries in this study. So we used an index of physical injuries and asked about the frequency of experience of these injuries. Statistically, we controlled for the number of full-time equivalents in the organization and employee gender. So here's a look at the model that we tested. I'm going to move fairly quickly through here so I can cover all of the material. So it's a multi-level model, and how that works briefly is at the between level, we're looking at different organizational scores for these variables here. So this would be an aggregate here. Top management physical safety climate would be the members of the top management team reporting on the CEO referent and their commitment to safety with Zohar's measure. So we'd have, on average, about 3 members per organization respond to the survey. We get an aggregate score there. Organizational physical climate, that's the supervisors and managers are reporting there, and the referent there is the top management team in this organization. Okay. Organizational support for safety was completed by frontline employees, and we aggregated that to the organizational level. So our sample is of organizations is 54. So we have 54 scores for each of these variables at the organizational level. And then at the, sorry for the font here, I kind of changed here, but this within level is the individual level. And the sample size at this level is 2,700. Okay? So we're parsing this out by its individual and its aggregate scores here, okay? And then we related this to physical injuries, also up at the organizational level as well. I think I'm going to leave it there, and if there's questions in the discussion about the method and how we analyze the data, I'll speak to them then. We used a multi-level structural equation modeling conducted in a program called M+ to analyze the data. I'm not a statistician, I will say that right now. If questions come up in Q&A, I'll do my best with them. There's R can be used for multi-level data. other programs can be used. We use this program. It's one of the advantages is more accurate parameter estimates, better handling of missing data, and you can estimate indirect effects of variables, which we wanted to look at. Item parceling, very briefly. So let's go up here. There's 16 items in this measure here, the organizational safety climate. 16 items that make that up, and 10 items that make up the top management physical safety climate measure. Oh, the mouse, yes. Right. So there's 16 items for the organizational physical safety climate and 10 items that make up here. We use a technique called item parceling, where you average items together and then use those parcels as indicators of the latent construct. Okay? Because we have a small sample size, parceling will help with the analysis for power. The hypothesized model demonstrated excellent fit overall with these indicators here. Very briefly, interclass correlation coefficients, we measured ICC 1 and 2. Very briefly, ICC 1, it's a measure of the percentage of variance that's explained at the organizational level, just due to grouping at the organizational level. And so what this means is that, for example, the top management team safety climate, which says 0.42, 42% of variance in their score is explained by group membership, organizational membership. 25% for organizational safety climate, and the supervisor support for safety, 18% of variance was related to the organizational membership. The ICC2 scores are a reliability statistic for group level variable. Anything above 0.7 is considered acceptable, and that statistic is influenced by sample size. So the top management team has a relatively small sample, so that's why it's a bit lower. So what did we find here? So just skip ahead here. We found strong support for the model, what we call a cross-level model. So we found that quite a strong positive relationship between the top management team physical safety climate and quite a strong relationship between organizational physical safety climate and organizational supervisor support for safety. So very strong effects there. We also found an indirect effect for top management team physical safety climate on the supervisor support for safety. So it's a mediated relationship through there. However, the relationship between the organizational supervisor support for safety and physical injuries at the organizational level was not significant. Correlation was in the right direction, but it wasn't statistically significant. However, at the individual level, where did my mouse go? At the individual level, the relationship was statistically significant. There was a negative relationship between supervisor support for safety and our index of physical injuries. So the stronger, the higher that employees scored their supervisor support for safety, the lower their scores on the index of physical injuries. So we also, I should note very briefly, we also tested alternative models where we considered, well, this is very top-down here. What about a sort of bottom-up influence on organizational safety climate? So we looked at organizational supervisor support for safety as a predictor of organizational safety climate. And when we measured alternative models, we found a poorer fit overall. So this model seemed to provide a best fit with the data we had. So one of the limitations, of course, is that these data they're cross-sectional in nature, so not longitudinal. So I mentioned earlier we've been collecting data for 5 years. So one of the things we're able to do is come up with different samples and limited, for example, organizations that have participated 2 or more times in the study. So I did do a quick look at the relationship between the top management team physical safety climate and and supervisor-reported organizational physical safety climate. And over time, over a period of 1 year, with a sample size of 41 organizations, there's strong positive correlation between the two variables. I'd say more generally that we find with our firms that have participated 2-3 times in the survey, a lot of stability in these measures. They don't change a lot over time, quite stable. So next steps in this research. Where am I now? We made revisions to our survey in 2014-15, and we expanded our measurement to include psychological safety, both in terms of a climate measure and also in terms of outcomes and employee health. And as many of you know who work in this field, the focus has really been on physical injury, and it's really kind of really driven by an industrial model of health and safety. Of course, the workplace has changed in many ways, and psychological health is getting growing attention, and so we wanted to include that in the survey. So very briefly, I'll walk you through how we changed the survey. We maintained the top management team physical safety climate, the organizational physical safety climate. Our index of physical injuries we changed. We changed to a one question, and it was just to fill in the blank, number of days that an employee had missed from work due to a work-related physical injury in the last 30 days. We also added other measures for top management team psychological safety climate. So the CEO in my organization demonstrates the psychological well-being of staff as a priority in this organization. And we use the same measure for the organizational safety climate. That's just another example item there. We use Kessler et al.'s 10-item measure of psychological distress as a health measure. So this is shown to be a predictor of anxiety and depression in individuals. Example item, in the past 30 days, how often did you feel that ... everything was an effort. And then similarly, we used one item to measure the number of lost time days due to a work-related psychological injury in the previous 30 days. So I'd like to turn now to some of the descriptive statistics which may be of interest to folks. These are data from the 2015-16 and 16-17 surveys, and you can see that we had almost 5,400 employees last year, and this year, as of mid-March, 7,400 in the survey. So you can see here the percentage of respondents that reported missing 1 or more days due to physical injury is relatively low, around 1%. If you contrast that to the percentage of participants missing a day or more due to a work-related psychological injury, it's almost 3 times greater. Okay. If we look at the sample among those who missed a day or more, so this is constrained to that group, you can see that the number of days is greater for those that experience a physical injury and a wider standard deviation. The psychological injury, the number of days missed, is relatively short, around 2 days, and a tighter variance around the mean. So I think some more evidence that we should be looking at psychological health in the workplace. And our system, of course, currently set up with workers' comp is not a lot of psychological injuries covered, unless it's PTSD or some clear path between a work-related incident and trauma, then it's likely not covered, but most physical injury would be covered. So, yes, 10 minutes left, perfect, good. So I want to give you a sense of where we're going, next steps in the analysis of the data. I have a few cautionary notes to share. I did my best in preparation for this talk to do the analysis that I I could do, but it's very preliminary. It's all correlation-based results. So there's a few words of caution are in order. I've not conducted a confirmatory factor analysis on any of these data. I've done exploratory factor analysis, and the variables seem to align pretty good, and the alpha scores are okay. The ICC scores have not calculated, no multi-level modeling, okay? So it's just, it is what it is right here. But this is just to give you a sense of where we're going. So the previous model that I just showed you with physical safety climate, front top management team, and then the organizational level, supervisors would have been here, and then time lost days. It's all organizational level model. So adding in the psychological safety climate here, they're represented on the bottom, and with psychological distress as a mediator between the psychological safety climate and time lost days for psychological injury here. So the past 2 years we've collected data on the psychological safety climate, psychological distress, and time lost days for psychological injury. And again, this is just correlation analysis here. Really just the first step in analysis, but I did want to show you. What's interesting here is that first of all, the top management team's psychological safety climate has no relationship to the organizational psychological safety climate, nor, and I don't show it on the figure here, nor the organizational physical safety climate. So that's interesting. And if I just say a word about that before moving on with the model, it was quite challenging to find a measure of psychological safety climate. I emailed researchers that work in this area in Canada, and I also emailed the Canadian Mental Health Commission to see what they're working on. And at the time, 2 years ago, there wasn't a measure. And so we used one from an Australian group that's been validated in that, but in our research, the top management team that really didn't seem to have any relation to other variables. But you can see there's interesting results, fairly moderate relationships here with a sample size of 68 to 80 organizations between climate, organizational, psychological climate, physical climate, psychological distress, and then ultimately time loss, psychological injury at the organizational level. Going down to a smaller sample size, so what about over time here? So looked at the relationship between last year's scores and this year's scores. So year one is represented by the boxes with the blue shading, and the others with the kind of pink shading there is year two. It's pretty good indication here that there's something going on here. Consistent relationship between the physical and psychological organizational safety climates and psychological distress over time. Okay, and I do stress here that these are also different reports. These variables here are reports by supervisors, managers, and frontline employees, and this is just frontline employees. Yeah. So that's sort of a brief snapshot of where we're headed with the research. There's more to come. I'm going to continue data collection in the coming year and increase the sample size to evaluate some longitudinal multi-level models. We have not to date incorporated administrative injury data and controlled, for example, for sector injury rates, which we could easily do. And that's something I want to look at. There's lots of other questions to look at here. There's a literature on CEO succession. So what happens when you get a change at the top of an organization? How does that impact the climate? And we can also look at how top management team composition changes the climate or variance in the climate scores over time. So that's a summary of the work we've been doing in Saskatchewan, and I now open it up to questions, comments.
Great. Thank you so much, Dr. Tucker, for your leader-centric viewpoint on health and safety. It's a very new and fresh perspective. We'll take questions.
Thanks, Sean. I had a question about the top management team and the safety climate and how that impacts the rest of sort of the organizational safety climate. What are some of the main factors do you think that those top level management people have or can do to influence the organization and beyond?
Thank you, Matthew. Yeah, I think demonstrating a commitment to safety through actions such as holding people accountable for safety performance in their department or division, empowering safety personnel wherever they are in the organization, at critical times, making a choice to do things a safe way versus the expedient way is another, I think, telltale behavior of a commitment to safety. Not taking shortcuts. To your question, we did conduct additional analysis here. One variable that is strongly associated with organizational physical safety climate, and this is a year 1 and year 2, these are correlations here, is does the CEO have a safety-related performance measure in their performance review for senior managers? Do they actually hold them accountable in annual review? And that's a strong incentive. It's variable. It's very strongly associated. So these are the senior managers are rating to what extent they have this in their performance review system in year 1. And at year 2, with the other employees reporting on safety, the correlation is fairly strong there. So it's a variable, I think, that's very important to be looking at. Yeah.
Hi, Sean.
Hi, Sue. Hi.
Thanks for a very interesting presentation. I just had a comment. I was involved in doing recruitment for the safety charter, a group of safety charters here. And what I found was very fascinating is when we spoke to people in the organization about recruitment that they were part of the safety charter, they didn't know.
Pardon me?
People in the organization did not know
Right.
that they were part of the safety charter. So the CEO goes out, we were in one of the events, they speak about it, they're very passionate, but it didn't go down, it didn't trickle down to the people who are doing health and safety because they didn't know that they were actually part of the safety charter.
Okay, I'll comment on that. Yes, that happens in Saskatchewan as well. There is a segment of CEOs that go, and this is a photo op for them, and this is a kind of, if you're sociology background, this is sort of an institutional thing you do, because why say no to it, right? Why not say yes? So we do come across that. I would also note that our sample size, we've had 152 different organizations participate, and there's 600 members in the charter program. So within the organization, their activities later on, it's a diverse group, and there's some that are really keen, and they're in it for the right reason. And also, CEOs are different places. Some are just figuring this out, and they don't know what next steps are if they've made a public pledge. So yeah, interesting observation. Yeah.
Hi there, I agree. This is a very interesting perspective. I'd like to bring a little different perspective. I noticed that you said at the beginning that Saskatchewan has one of the worst injury records of all provinces for workers' injuries. Is that?
That's correct, yeah. We used to be second worst, now we're third worst.
Oh, okay, you're improving. All right. But one of the things that I do research on is traffic injuries, and actually Saskatchewan is twice as bad as other provinces on traffic crashes, which blows my mind. I'm not sure why you're such an outlier. So I'm just curious about, that doesn't follow the farming issue, I don't think. I guess there's a big rural population driving on rural roads, but I'm just curious what's going on in Saskatchewan.
So drinking and driving, highest in the country, and the rates are coming down, but we have a cultural problem in the province, and that's among safety prevention folks, and that's sort of the consensus, that we've got a cultural problem, and we pay a high price, with lost lives, higher health care, more people using the system, and until we come to terms with that, we're going to pay for it, unfortunately. And it's frustrating at times, but yeah.
Okay, I've got some online questions here. First one is, would you say that safety climate and safety culture are synonymous? If not, how are they linked and how do they differ?
Okay, so it's a great question. So when I'm speaking to an audience of like business folks and that, I'll just use the terms interchangeably because it's just like a headache to go through it all. But culture is really a broader term for the organization. Climates are really around groups in organizations. So I mentioned earlier, you can have a climate in the top management team, and that may be like 6 people in the room. A climate for the organization as a whole, which is larger, which is closer to culture. Or at your team level, your supervisor, there's maybe 12 people in that work team there. That can be a climate as well. So culture is just a bigger phenomenon that dictates broader norms in the organization.
Okay, I'm trying to parse this question, which says it's part comment, part question, and you might have to help. BP was reorganizing its safety program after the Texas City disaster.
Mm-hmm.
At Macondo, they were still basing much of the program on Heinrich. Human behavior is a simplistic approach. See Hollander, Reason, and Hollander, and Levison on human factors and systems. Does that make...
I'll make a comment that if you're kind of interested in kind of a broad overview of BP and what happened there, PBS Frontline is an excellent documentary on this, and they talk about what happened in Texas, what happened in Alaska with some pipeline leaks, and generally with the general norms at the time is cut costs, and then when Hayward came in, there was more of the focus was moving, I think, more to safety. But it was probably too late for BP. At least that's the way that documentary investigative report characterizes it.
Okay, and did you control for age in your analyses?
We controlled for 2 variables. So at the organization level, number of full-time equivalents, and it wasn't statistically significant. And so there's the full-time, actually there's really no relationship there for full-time equivalents, and employee gender here, which was not significant. We did not control for age.
And then I have a question of my own, which is how much does the size of the organizations impact these relationships? It seems like if the CEO is closer to the frontline personnel, there might be a stronger relationship there, but...
I think so. I think it's something it's a great question, and also like how dispersed is the organization with different locations. So, again, we controlled for organizational size, but I think this is a variable that warrants a lot of attention, maybe as a moderator variable as well. The levers that an organizational head is going to pull if they're like BP, I think, are different than they are if it's a tow truck company. And I've got like 3 layers in the hierarchy. So I think it's something, it didn't show up here, but I think it warrants attention. I agree.
Hi.
Hi.
In one of your final diagrams at the end with the correlations, it looked like some of the upstream factors were correlated with psychological injury, but it didn't look like they were correlated with physical injury, and I was wondering if you had any insight as to why that might be, or if I'm just reading it wrong.
Yeah, I think at the organizational level, why we're not picking up effects is because the data is really skewed to 0. We've got a lot of organizations with 0 injury, and we just don't have the variance. And I think that's what, in the first study, why we didn't find effects at the organizational level. There's a lot of 0 versus this. This is whether you're in manufacturing or office setting, and that the psychological days due to psychological injury, you're going to see it across all sectors. So could be, and yeah, could be. I mean, the sample size is relatively small as well. So maybe if you're working with administrative data, another factor I would add in here is that we're talking about injuries in the last 30 days. So I mean, it really tightens it down. So even at the organizational level. We're still seeing many organizations with 0 days off for physical injury. So, yeah. In the last 30 days. Yeah, it's a pretty tight measure. So recall bias is concerned about that. But it's a pretty tight measure when you're looking to find effects for psychological injury last 30 days. So yeah.
Hi again. I have a question with regards to recruitment and how you went about it. So you approached I'm just wondering if you can talk about the process of approaching the organization and how you got so many employees under one organization, if it was voluntary or mandated or consent. Okay. How did that?
Okay. Yeah, great question. We can talk more about this after too, because so we've got research ethics approval for the study first and foremost. So they have this annual charter signing event in June. 2 months before, a letter will go out to all new and existing charter members saying, here's your WCB injury rate, and by the way, these folks at the U of R are doing this study. They're going to be in touch with you. So there's awareness there. Then at the event, we've got the booth. We'll have sign-up sheets on tables. There'll be an announcement there. We would probably get 10 or 15 at that event, usually people we've seen before. And then we begin this process of emailing people and even phone calls. So all that we'll do a mail out, like email out to the new signatories to the charter, existing, those that have participated before, we'll send them their previous benchmarking report. And everybody will receive a sample benchmarking report so they can see what they're getting in return. That's, I think, really important to show them why they should do this rather than just another survey. And then we follow up with them, and we kind of cap recruitment off around January each year. If they're not in by then we're moving on. We'll send out what we call interim benchmarking reports. So if they participate in July, they'll get a report by October. They don't have to wait a whole year for all the data to come in. So we do a rolling thing like that. We work with them very closely. We'll do hard copy surveys. We report on individual locations, so that's attractive to them. But it takes some administrative effort to do that. We charge for the hard copy surveys on a cost recovery basis. And we also, if they want to put other survey questions in, we'll do that for a cost. So we've had a couple large organizations said, you know, we like this, but we want all these add-ons, so we'll work with them to do that. So we're flexible with them.
And the people who respond, are they mandatory responses or are they voluntary within the organization?
So the first thing with any research, we'd have the consent form at the beginning of the survey. So it's voluntary. And we are, in the letter of information that goes out to the CEO, it's clear that it's all voluntary. We send out instructions with the hard copy surveys that it's a non-management employee that would be administering the surveys, and it's voluntary whether that employee wants to complete the survey. So we're strict on that. At the end of the day, we haven't, I think we've just had 1 or 2 over 5 years incidents where they didn't follow the protocol, you know, and we, you know, attend to those immediately, notify the research ethics board that we're aware that there's been an exception to the protocol type thing, yeah. Yeah.
Is there any other questions?
Another online question. Oh, it just disappeared. The presence of enhanced disability management programs or stay/return to work programs will directly impact the number of days lost, potentially confounding the analyses. Your comment?
Yeah, so return to work. Okay, so we have a pretty high injury rate in the province, but it's come down dramatically recently, and part of the reason for that is more aggressive return to work in the province. I have no doubt about that because senior managers in safety told me that they haven't spent any more money on safety, but their lost time injury, number of lost time injuries coming down. And I don't know what the pattern is here in BC, but that's certainly there. So that certainly is a factor, and also injury reporting is influenced by the safety climate as well. The weaker the safety climate, the higher the claim suppression rate. Okay, higher the underreporting is. So yes, it's there. I think that's part of the reason we use self-reported injuries over a short period of time is to try to get around those filters. But it is an issue, and it certainly it's a legitimate question. I think it's something we all need to think about going forward about how return to work is handled and how aggressive the accommodations are. And are the accommodations reasonable, or are they just having somebody coming back? So we deal with that issue. It's a great question.
All right, well, thank you all for joining us, and please help me thank Dr. Tucker for his presentation today.
Okay, thank you.